Your hips aren't supposed to feel like that when you wake up. That pinching, that stiffness, that sensation like something is locked and won't unlock for the first 10 minutes of your morning. Most people think it's arthritis getting worse. Most people think it's just what happens when you get older. Most people don't realize they've been sleeping in a position that's essentially torquing their hip socket all night long. And the problem isn't the joint itself. The problem is the angle. The hip joint is a ball and socket. The ball is the head of your femur, your thigh bone. The socket is part of your pelvis, and it's called the acetabulum. Now, here's what most people get wrong about this joint. They think the socket faces straight down. It doesn't. It faces forward and down and slightly to the side. The angle is somewhere around 35 to 45 degrees depending on your individual anatomy. When you lie on your side, the way most people do, just rolling onto your hip and letting your top leg flop forward, you're not aligning with that angle. You're fighting it. You're pulling the ball of the femur in a direction the socket wasn't built to accommodate, and you're doing it for 6, 7, 8 hours straight every single night. That's not arthritis. That's mechanical stress. And the difference matters because one is permanent and one is fixable. I see this constantly. People come in saying their hip pain started around age 55 or 60. They describe it as a deep ache right in the crease where the thigh meets the hip. Sometimes they say it feels like the joint is catching, like there's something getting pinched in there. Sometimes it's more of a dull sensation that gets worse throughout the night and better after they get up and move around for a few minutes. And they think that's a sign it's arthritis because movement helps. But movement helps because you're finally getting the joint out of that compressed position. They've usually already done an X-ray. The X-ray shows some mild degeneration, and so everyone concludes that's the problem. Osteoarthritis, early stage. It's only going to get worse. Start thinking about your options. But the X-ray doesn't show you how you're sleeping. It doesn't show you that your hip has been in internal rotation for 8 hours every single night for the past 5 years. Here's the thing. The cartilage in your hip joint is incredibly adaptive. It's designed to handle movement, but it's designed to handle movement in the directions your hip was built to move. When you keep loading it in one stuck position night after night after night, you're creating inflammation. You're creating wear patterns that don't match the joint's natural geometry. And yes, that can look like arthritis on an X-ray. But it's not necessarily irreversible. It's not necessarily progressive. It's often positional damage, and positional damage has a positional solution. The bedtime stretch I'm going to walk you through addresses this directly. It's called the 9090 stretch. And it's one of the most useful things I've found for people who wake up with hip stiffness or that clicking sensation or that deep ache that takes 15 minutes to go away. The position itself is simple, which is probably why nobody does it. Simple things don't get attention. Simple things don't get published in medical journals. Simple things don't sell courses or devices or injections. But simple things work. You lie on your back, you bend both knees 90 degrees, one foot stays on the floor, the other leg, you bring it up and across your body so your knee is pointing out to the side and your shin is roughly parallel to the front of your torso. So if you're lying on your back and you do this with your right leg, your right knee ends up somewhere near your left shoulder. And your right shin is pointing roughly toward the left side of the room. Your back stays flat on the floor. Your shoulders stay on the floor. Your head doesn't lift. From there, you're going to gently apply pressure to the top of your right thigh bone, the femur, pushing it down toward the floor. Not aggressively. This isn't stretching in the way you think of stretching. You're not trying to achieve a big range of motion or some impressive flexibility demonstration. You're trying to achieve a sustained, gentle pressure that creates what's called external rotation of the femur. You're rotating the ball of your hip socket in the direction it's designed to rotate, and you're doing it slowly enough that your nervous system isn't fighting you. That's the key difference between this and just lying there with your leg crossed over your body. The active pressure, the controlled pressure, that signals to your body that this position is safe. It's not a surprise stretch. It's not a forcing of tissue. It's a negotiation between your nervous system and the muscles that have gotten tight from years of being held in the wrong position. Most people hold this for somewhere between 60 and 90 seconds on each side. I know that doesn't sound long, but physiologically, a lot happens in that window. The muscles on the outside of your hip, the piriformis in particular, starts to quiet down. The deep rotators of the hip, the obturators, the gemellus muscles, they start to release. The hip capsule, which is the ligamentous structure around the joint, begins to release tension that it's been holding for hours every night. And if you've been sleeping in internal rotation night after night, you'll feel something almost immediately. There's usually a sensation of things opening up, of pressure that you didn't even realize was there suddenly easing. Some people describe it as clicking or popping, which is just gas bubbles coming out of the joint fluid. That's normal. That's actually a good sign. Now, the reason this works for sleep specifically comes down to something called proprioception, which is your body's sense of where it is in space. It's how you know where your limbs are without looking at them. When your hip has been held in one position for hours every night, the proprioceptive feedback from that joint gets stuck. Your nervous system thinks that's the position it should be in. It becomes the default. When you wake up and move, it takes a few minutes for that system to recalibrate. You're stiff because your nervous system is still sending the signal that your hip should be in that compressed position. But if you perform this stretch right before bed, you're essentially recalibrating that feedback in the position you're about to spend the next 8 hours in. You're telling your nervous system where your hip should actually be. And then when you lie down to sleep, the muscles and connective tissue around the joint have that recent memory of good positioning. They're more likely to hold you in alignment throughout the night. They're less likely to pull you back into that internal rotation position that creates the morning stiffness. There's also a vascular component here that I don't think gets talked about enough. The hip capsule has a very rich blood supply. Arteries run into it. Veins run out of it. There's constant exchange of oxygen and nutrients and waste products. When you're holding your hip in a compressed position all night, you're restricting some of that blood flow, at least locally. You're creating a hypoxic environment where the cartilage and the synovial fluid aren't getting the circulation they need. That contributes to the inflammation you feel in the morning. That contributes to that achy, stiff feeling. The 9090 stretch. By creating space in the joint and by actively moving the femur through its natural range, actually improves circulation to the joint itself. It's like you're pumping fluid through a system that's been stuck. I had a patient, 72-year-old woman, who'd been waking up with that deep hip crease pain for about 4 years. She'd had x-rays, she'd had an MRI, everything pointed to mild osteoarthritis, and she was basically resigned to it getting worse. She was looking at corticosteroid injections as a next step. Her doctor had mentioned that if it progressed, a hip replacement was possible down the line. She was in her early 70s and thinking about replacement surgery. We started this stretch 6 nights a week to begin with. She did it right before bed for about 5 minutes. That's 5 minutes total, both sides combined. After 2 weeks, she said the morning stiffness was noticeably less sharp. It still took her a few minutes to get going, but it wasn't painful. After 4 weeks, she said it was almost completely gone. She's wake up and she could move. After 8 weeks, she said she felt like she had her hip back. That was 3 years ago. She still does it most nights because she said once the pain went away, the habit stuck. She liked how she felt in the morning. She liked not waking up worried about her hip. She's never had the injections. She never had any surgery. She did the stretch. But here's where I need to be careful about expectations. This isn't magic. If you have significant cartilage loss, if you've had x-rays that show moderate to severe osteoarthritis, if you can see bone-on-bone contact on the imaging, this stretch is helpful, but it's not going to reverse the damage. It can reduce inflammation. It can improve your morning mobility. It can take you from waking up stiff and achy and limping to waking up stiff for maybe 2 minutes. That's worth something. For a lot of people in their 60s and 70s, that's everything. But it's not going to regrow cartilage. Nothing does that right now, and anyone who tells you otherwise is lying to you. The stretch also works better the earlier you start it. If you're already in your 40s and you're waking up with some hip discomfort, some clicking, some not quite right sensation, getting into this habit now means you're much less likely to have the kind of progressive morning stiffness that starts in your 50s and 60s and gets worse from there. It's preventive in that sense. Your hip joint is something you're going to carry with you for the rest of your life. Unlike your knees, which have a lot of supporting musculature around them, your quadriceps, your hamstrings, all of that, your hip joint is quite exposed to whatever positioning habits you create. 8 hours a night, every single night, for 50 years, that adds up. That's 146,000 hours of positioning. That's more than 16 years of your life spent in one position. The cumulative effect is enormous. The positioning while you're actually sleeping matters just as much as the stretch, maybe more. Most people sleep on their side. That's not wrong, but the way you're doing it probably is. If you're lying on your side and your top leg is just dropping forward the way gravity wants it to, you're back in that internal rotation position. Your femur is rotated inward, the hip capsule is twisted slightly, and you're creating the exact compression you just spent 5 minutes releasing. So here's what needs to change. When you're lying on your side, you need to place a pillow between your knees. Not under your top knee, between your knees. This keeps your hips stacked. It keeps both femurs in the same neutral rotation. You're not perfect in this position, but you're close. Your hips aren't torqued. You're sleeping in something closer to how the joint was designed to rest. Think about how you'd position your legs if you were standing. Your feet are about hip width apart. Your knees are facing forward. Your hips are neutral. Your femurs aren't rotated inward or outward. They're just sitting there. A pillow between your knees when you're lying on your side recreates that standing alignment. It's simple, but it's not nothing. Some people also need a pillow under their waist if they're a side sleeper, especially if they have a pronounced curve to their spine or if they're carrying more weight in the torso. This keeps your spine from dropping into a sideward curve that actually creates tension in the hip on the bottom side of your body. The side you're lying on, that hip is compressed, sure, but that's unavoidable. You're putting body weight through it. The bottom hip is the one that often gets overlooked. And if your spine is rotated or curved because of inadequate support, that bottom hip is being torqued in a different way. You're creating a rotational stress on the side that's underneath you. Getting your spine neutral solves that. Back sleeping is actually better for your hips. And I know that's an unpopular thing to say because a lot of people can fall asleep on their backs. But if you can tolerate it, or if you can drift off on your back and then roll onto your side later, your hip joints are going to thank you. When you're on your back, both femurs are in neutral. There's no rotational stress. The hip capsules aren't twisted. The joints aren't being compressed in a way that restricts blood flow. For people who wake up with bilateral hip pain, pain in both hips, not just one, switching to back sleeping or spending at least part of the night on their back can make a dramatic difference. I had a man, 68, who'd been waking up with pain in both hips for about 2 years. His first instinct was that he needed new hips, new procedures, new interventions. He'd already had 3 consultations with surgeons at different hospitals. He was getting ready to schedule a pre-operative evaluation for his first replacement. But here's what we found when we did a proper intake. He was a hardcore side sleeper. He slept on his left side, woke up at 3 in the morning, couldn't get comfortable on his left side, rolled to his right side. He was rotating from one compressed position to another all night. He was never in a neutral position. Both hips were taking turns being the compressed side. We got him to spend the first part of his night on his back, with a pillow under his knees to keep some bend in his hips and keep his lumbar spine neutral, and to side sleep only in the second half of the night once he'd been in the neutral position for a few hours. It took about a month for his nervous system to adapt, a month of slightly worse sleep because he was in an unfamiliar position. But after that month, the bilateral pain was reduced by maybe 70%. He still has some stiffness, especially on the side that was worse, but it's nothing like it was. He canceled his surgeries. He never had the replacement. Now, the stretch itself, I want to walk through in more detail because the difference between doing it right and doing it wrong is actually significant. The common mistake is just lying there with your leg crossed and thinking that's enough. It's not. You're lying on your back. Make sure your back is actually flat. I'm not joking about this. A lot of people think they're lying flat and they're actually still slightly arched. If you can slide your hand under your lower back, you've got an arch. You need to press your lower back into the floor. This doesn't mean tucking your pelvis or doing any of that pelvic floor clenching business. It just means neutral. Your pelvis isn't tilted, your lower back isn't lifted, your sacrum is in contact with the floor. Then you bend both knees. Your feet are hip width apart, knees pointing up at the ceiling. Both feet are on the floor. From there, you're going to take your right leg and cross it over your body. Here's where people usually make a mistake. They try to touch their right knee to the left side of their body, or they try to achieve this deep stretch where the right shin ends up parallel to the left side of their torso, and they're getting this intense sensation. That might be the end game for some people with very loose hips, but it's not the starting point. If you've got tight hips, especially if you've got that kind of deep aching hip pain that I described, you might not be able to get there, and you don't need to. The position is a starting point. Your right knee goes across your body as far as is comfortable. Your right shin points somewhere toward the left side of the room, could be 45 degrees, could be 20 degrees, could be straight to the left and parallel to your body. The amount of rotation doesn't matter, the direction does. You're moving into external rotation, which is the opposite of the internal rotation you've been doing all night. Once you're in that position, you place your right hand on top of your right thigh, somewhere between your knee and your hip, and you apply downward pressure. Again, gentle. This is not a bouncy stretch. This is not a forced range of motion. This is sustained, controlled pressure. You're pressing your femur down toward the floor. You're using your hand weight and maybe a little bit of applied pressure. You'll feel this on the outside of your hip, maybe in your glutes, maybe along the outer edge of your thigh. That's all correct. That's the piriformis and the external rotators firing slightly and then relaxing. If you feel it in your lower back, you've gone too far. Pull back. This is usually a sign that your back is starting to arch or that you're pushing too hard. The pressure should be steady and gentle, not more than you could maintain while reading a book. Some people describe it as a comfortable ache. Some people describe it as a pleasant pressure. It should feel like something that needs to happen, not something that hurts. Hold that for 60 to 90 seconds. Count it out if you need to. Some people count to 60 slowly. Some people set a timer on their phone. However you do it, Get to about 90 seconds. Then slowly release the pressure and slowly unfold your leg back to the starting position where both knees are pointing up at the ceiling. Rest for maybe 20 seconds. Then repeat on the other side. Left leg crosses over, right foot stays on the floor, left hand presses the left femur down. Same duration, same gentleness, same attention to keeping your back flat on the floor. After you finish the second side, you're done. That's the whole stretch. 5 minutes total, 10 minutes on busy nights if you want to hold it longer, which some people do. Some people need to do this twice a night, especially if they have significant hip pain. Morning and night. 5 minutes total each time. Some people do it just before bed. The consistency matters more than the frequency. 5 minutes a night, every single night, is going to give you better results than 20 minutes once a week. Your hip joint is receiving a repeated signal about what its resting position should be. That signal needs to be consistent. You need to do this enough times that your nervous system stops fighting the position and accepts it as normal. That takes repetition. For most people, that's around 2 weeks. For some people with very tight hips, it's 3 or 4 weeks. But 2 weeks is the ballpark. After about 2 weeks of consistent stretching, you should start noticing something. Your mornings might be slightly less stiff. You might be able to get out of bed without that 10-minute mobilization period where you're hobbling around like you're still waking up. After 4 weeks, the difference becomes more pronounced. You notice you're sleeping better. You notice you're not as stiff. After 8 weeks, some people describe it as completely transformed. I want to be specific about this because the timelines matter for motivation. If you do this for 3 days and expect miracles, you're going to quit. You're going to think it doesn't work. But it does work. It just needs time. If you commit to 4 weeks and you know that week 1 might not feel like anything's changed, week 2 might feel slightly better, maybe a little less sharp in the morning, and week 4 is when you'll see a real difference, you're much more likely to actually do it. You have realistic expectations. You're not disappointed after 3 days. There's also something to be said for the ritual of it. A lot of people find that doing this stretch becomes their cue to the body that bedtime is coming. The parasympathetic nervous system, the rest and digest part of your nervous system, starts activating. Your heart rate drops. Your breathing deepens. You're doing a mild physical activity that's structured and intentional, and then you're moving into sleep. People often report falling asleep faster and sleeping more deeply. Some of that is the stretch itself. Some of it is probably just the consistency of having a wind down routine. Your body likes predictability. It likes knowing what comes next. When you do the same thing every night before bed, your body starts preparing for sleep before you even get into bed. One more thing I want to address, because I get asked this a lot. What if you've already had hip surgery? What if you've had a hip replacement? What if you have a hip labral tear or you've had repair? The answer is that it depends on what your surgeon said and how recent the surgery was. In the first 6 months after hip surgery, you're usually not doing any stretches on your own. You're working with a physical therapist. You're following specific restrictions. Your hip is healing at a cellular level. You're not messing with that. But after you've cleared all the acute healing phases, after the bone has integrated with the implant, after your surgeon has cleared you for normal activity, the 9090 stretch is usually fine. In fact, it's often recommended. Your new hip needs to move through its full range of motion. It needs to be loaded in different directions. The stretch helps with that, but you need to clear it with your surgeon first. You also need to understand the restrictions that come with your particular implant. Some implant designs have something called a precaution range, a range of motion that can cause the ball to pop out of the socket if you move into it too quickly or too forcefully. Usually your surgeon gives you paperwork about this. The 90 stretch usually isn't in that precaution range, but you need to be sure before you start. Some implants are more restrictive than others. And here's the honest part about all of this. If your hip pain is severe, if you're waking up in significant pain, if you're limping during the day, if you can't walk more than a few blocks without needing to sit down, if you've had imaging that shows moderate to severe arthritis, this stretch is not a substitute for medical evaluation. You need to see someone, you need imaging, you need a proper diagnosis. You might need injections, you might need manual therapy from a physical therapist, you might eventually need surgery. The stretch is something you do alongside those things, not instead of them. But for the large group of people, and this is actually a huge group, I think larger than we talk about, who wake up stiff, who have that dull, aching feeling, who think it's just getting old and there's nothing to be done about it, who haven't yet had any imaging or any real workup, who are just accepting this as inevitable. This changes things. This is the thing that works, not because it's complicated, not because it's revolutionary, not because it requires special equipment or expensive supplements or devices, but because it actually addresses the specific mechanical problem that's happening in your joint while you sleep. The question I sit with, the one that doesn't have a clean answer, is why this isn't standard advice, why people aren't told about it at 60, why it takes reaching 70 or 75 and being in significant pain before someone finally explains that the way you're sleeping matters. Why we wait for damage to accumulate instead of preventing it in the first place. Why we treat the consequence instead of addressing the cause. There's something about Western medicine that loves the intervention, the injection, the surgery, the procedure, the thing you do to fix something. But prevention, actual prevention, that's somehow boring. That's not what gets studied. That's not what gets published. That's not what sells anything. So people wake up stiff and achy and they assume it's age and they assume it's inevitable and they assume they're heading toward surgery. But they're not. They're just sleeping wrong. And that's fixable.